Hello everyone, I am Dr. Sarita Jain. In today's video, I will be discussing about the different strategies for the management of PCOS. PCOS is a prevalent condition. It affects a significant number of women of childbearing age. Its incidence is about 8 to 13%. It disrupts the normal functioning of the ovaries. Now, how does PCOS affect the body? In PCOS, there are issues with the ovulation. In a regular cycle, women release an egg each month. In PCOS, there is interference with this process causing irregular ovulation or failure to ovulate. Also, there is hormonal imbalance. The communication between the brain and the ovary is disrupted, leading to a hormonal imbalance. In this condition, there is thickening of inner lining of the uterus, which results in heavy periods or other complications. In this condition, there is also insulin resistance. This condition resembles having a key that doesn't fit a lock. Insulin doesn't work effectively, leading to elevated blood sugar levels. Also, there is metabolic syndrome. This is a collection of conditions increasing the risk of heart disease and diabetes. This is much like a chain reaction where one issue can lead to others. Also, there is chronic inflammation. Body might feel persistently inflamed, similar to a wound that never fully heals. Now, how to manage PCOS? First line of treatment is lifestyle modification. Over 50% of women with PCOS are overweight or obese. Weight loss is often the initial recommendation because it can help address the symptoms like hormonal imbalance and high cholesterol. While exercise is crucial for the management of PCOS, diet plays a very significant role in managing PCOS. There should be focus on high fiber food like fruits, vegetables, whole grains, and diet should be rich in protein also. Protein can be obtained from lentils, chickpeas and paneer. Aim should be for about 1 gram of protein per kilogram of body weight. Target a daily intake of 1200 to 1500 calories, reducing your usual intake by 500 to 750 calories. Even a 5% reduction in weight can normalize menstrual cycle and enhance the effectiveness of fertility treatment and improves the chances of ovulation, pregnancy and a healthy baby. PCOS has a genetic component also. Different gene affects the ovulation, hormonal levels and ovarian appearance. For those with PCOS and seeking pregnancy, inducing ovulation is crucial. Around 70% of women with PCOS struggle with ovulation or do not ovulate at all. So, first drug used for the ovulation induction is clomiphene citrate. This is also known as Clomid. This is the primary medication for inducing ovulation in women with PCOS, especially younger women. Clomid blocks the estrogen in the brain, tricking it into producing more hormones, that is FSH and LH, that stimulates the ovaries to release an egg. Typically, it is taken for 5 days starting between the 2nd and 5th day of the menstrual cycle. Doses begin at 50 mg per day and increases up to the 150 mg per day. Sometimes Clomid alone is not effective. In these women, metformin is added to Clomid to increase the chances of ovulation. Clomid is successful in about 30% of the pregnancy, but there is 20% chances of miscarriage or stillbirth. There are certain side effects with the use of Clomid. These are ovarian enlargement, ovarian hyperstimulation syndrome, multiple pregnancies, hot flashes, gas, bloating and tiredness. Next drug for the ovulation induction is letrozole. It helps ovulation by blocking estrogen production in the ovaries. It prevents the conversion of androgen to estrogen. Lower estrogen level prompt the brain to release more FSH, making the ovaries more responsive and increasing the likelihood of egg release. Letrozole is effective in inducing ovulation in many women with PCOS who struggle with treatments. Now, next drug is gonadotropin. Gonadotropins are hormones used when first-line treatment like letrozole or Clomid fails. They directly stimulate the ovaries to produce and release eggs. Gonadotropins are more potent and require careful monitoring due to the risk of multiple pregnancies. Now, what is the connection between insulin and PCOS? In PCOS, insulin resistance leads to elevated insulin level, causing the ovaries to produce more androgens and disrupting normal ovulation. Insulin resistance worsens PCOS symptom and increases the risk of type 2 diabetes and heart disease. A common sign in PCOS is acanthosis nigricans, in which condition there is dark velvety patches on the skin. Management of insulin resistance involves lifestyle changes and medication that improve the insulin use, which is crucial for reducing symptoms and preventing long-term health issues. Management of insulin resistance involves lifestyle changes and medications that improve insulin use, which is crucial for reducing symptoms and preventing long-term health issues. Metformin is the common drug used for this condition. Originally, it was used for the type 2 diabetes. Now, it can be used effectively for the management of PCOS by enhancing insulin sensitivity and regulating blood sugar levels. Metformin improves the body's response to insulin, lowering blood sugar levels and reducing type 2 diabetes risk. It also helps in weight loss and improves the lipid profile. It reduces the triglycerides and increases the HDL cholesterol, which is crucial for the heart health. Metformin is started at the 500 to 850 mg per day, and doses is gradually built up to 2000 mg per day based on the tolerance. Common side effect includes nausea, vomiting, diarrhea and abdominal discomfort. It can be prevented by starting at a lower dose, which can help manage these side effects. Long-term use of the metformin can lead to the vitamin B12 deficiency, which can be managed by the supplements. Some women may experience gastrointestinal issues, and in those, alternative treatments are needed. Apart from metformin, inositol can also be used for the insulin resistance. This is a dietary supplement that enhances the insulin signaling and can improve the menstrual cycle and ovulation in PCOS women. It is generally safe with very few side effects, and this is relatively inexpensive. Next drug used for insulin resistance is glucagon-like peptide. This boosts the insulin release from the pancreas, especially after the meal. It improves blood sugar levels and aids in weight loss, beneficial for managing PCOS symptoms. Statins are also used for the management of PCOS. These lowers the cholesterol level by inhibiting cholesterol production. They improve lipid profile by reducing LDL cholesterol and increasing HDL cholesterol. Statins can also lower certain hormones, those are linked with the PCOS, and improve vitamin D levels. Statin should be used with caution in women of childbearing age due to potential risk to pregnancy. Next treatment option for the management of PCOS is anti-androgens. These are medicines which are used for the management of excess hair growth and acne by blocking the male hormones. Most common anti-androgen used for this purpose is spironolactone. This is effective and cost effective. This is typically used in the doses of 25 to 100 mg twice a day. Other anti-androgens used for this purpose are flutamide and finasteride. They are as effective as the spironolactone. OC pills are combination of estrogen and progesterone, and symptoms start improving after 6 months of initiation of the treatment. Sometimes OC pills are combined with the anti-androgens because in this combination they are more effective in lowering the testosterone and relieving the symptoms. Some OC pills may increase the blood clot risk, so alternative treatment should be considered in these high risk patients. Next drug for the management of PCOS is medroxyprogesterone acetate. This is a synthetic form of progesterone. This helps in symptoms associated with PCOS. It helps in the management of menstrual irregularities. It regulates the menstrual cycle and reduces the abnormal bleeding. This also reduces the androgen production. If you are dealing with the symptoms like unwanted hair growth or acne, MPA works by suppressing the production of androgen, which can help alleviate these issues. Many women with PCOS face insulin resistance. MPA improves how body responds to insulin. High cholesterol level often associated with the PCOS, MPA helps improving your lipid profile also. MPA is especially useful for those who are not planning to conceive but need help managing the irregular periods or elevated androgen levels. Next is orlistat. Orlistat acts by blocking the lipase enzyme in the stomach and pancreas and leading to the reduced fat absorption from the diet. Orlistat helps to reduce the body weight and improve the markers such as cholesterol and insulin resistance. It's beneficial for weight loss and could help prevent the type 2 diabetes. For women with PCOS, Orlistat can lead to the significant weight loss and better metabolic markers. Dose recommended for the Orlistat is 120 mg taken 3 times daily with meals. Orlistat is effective in the weight loss, but it has certain side effects also like gastrointestinal issues such as diarrhea, stomach pain and flatulence, and there is also chances of deficiencies in fat soluble vitamins like A, D, E and K. Another drug used for the weight loss is sibutramine. This is an appetite suppressant. It worked by affecting neurotransmitters like serotonin, norepinephrine and dopamine, but it is withdrawn from the market due to cardiovascular risk. Next supplement is vitamin D. Vitamin D deficiency is common in women with PCOS and it affects about 45 to 90% of women with PCOS. Low vitamin D levels are associated with reduced ovulation rates, lower chances of the pregnancy and lower live birth rate in women with PCOS. If these are supplemented with vitamin D, then there are better chances of ovulation and overall chances of pregnancy are increased by this. So, to summarize, PCOS is a multifactorial condition. It involves hormonal, metabolic and psychological issues and it is a leading cause of infertility. Treatment should be started with lifestyle modification before jumping to the pharmacological treatment. Small changes in weight can lead to the significant improvement in this condition. PCOS increases the risk of endometrial cancer, but it does not affect the ovarian or breast cancer risk. Letrozole is often preferred for inducing ovulation, followed by clomiphene citrate. If these do not work, then gonadotropin might be used. For those who do not benefit from these treatments, then ART can be considered. Metformin, especially when combined with CC or gonadotropin, is effective, particularly for insulin resistance. Inositol and vitamin D could also be beneficial in the management of this condition. So this was all about the management strategies for the PCOS. If you found this video useful, please like and share the video and subscribe my channel. Thanks.